scalp is going to extend from the superciliary arches anteriorly to the external occipital protuberance and the superior nuchal line, which are present posteriorly, and towards the temporal lines laterally. So it has 5 layers, and let's talk about these 5 layers. The mnemonic of these 5 layers is going to be SCALP. So S for skin, C for connective tissue, and A for the aponeurosis, which is basically the epicranial aponeurosis, L for the loose areolar tissue, and P for the pericranium. So what do we know about the skin? So you need to remember only 3 things about the skin. The first thing is that it is going to be thick, it is going to be hair-bearing, it is going to contain sebaceous glands. The second layer is connective tissue, which is present right beneath the skin. It is a fibrofatty layer, and it has some blood vessels as well. So what are the blood vessels that are present in the connective tissue? We just need to remember that it has arteries coming from the external and internal carotid arteries. And there is going to be free anastomosis between the external and internal carotid arteries. So now let's talk about the epicranial aponeurosis. So what is aponeurosis? Aponeurosis is basically a thin tendinous sheet that is going to unite the occipital and frontal valleys of the occipitofrontalis muscle. And the lateral margins of the aponeurosis are attached to the temporal fascia. Okay. So now there is also this important thing, which is the subaponeurotic space. It is a potential space which is present deep to the epicranial aponeurosis. It is limited in the front and behind by the origins of the occipital frontalis. Okay, that is all you need to remember. Now let's talk about the 4th layer, which is the loose areolar tissue. There is going to be some sort of a significance of this layer as well. So now let's talk about this loose areolar tissue. It is going to occupy the subaponeurotic space, which was a potential space. Okay, and which was limited in the front and back by the occipital frontalis muscle. Significance of the loose areolar tissue is that this is the plane of movement of the scalp. That is when the scalp moves, the first 3 layers, which are the skin, connective tissue, and the aponeurosis, are going to move along the loose areolar tissue layer relative to the small arteries. Okay, and it also has some emissary veins. So what is the significance of these emissary veins? The significance is that they're valveless and they are going to connect the superficial veins of the scalp with the diploic veins of the skull bones, and also with the intracranial venous sinuses. And okay, now let's talk about the last layer, which is the pericranium. It is basically a periosteum, which is covering the outer surface of the skull bones, and osteum are the sutures between the individual skull. So that was all we needed to remember about this.